Today, we're diving into a topic that affects millions of people throughout the world. Kidney stones. Let's talk about what they are, their symptoms, why they form, how they are diagnosed, treatment options, and how to prevent them. This is MedScience Simplified. I'm Dr. Zikky. I am a board-certified radiologist. First off, what are kidney stones? Kidney stones are like tiny, solid crystals that form from minerals and acids and salts that usually get filtered from your kidneys. They can be as small as a grain of sand or as large as a golf ball. These tiny troublemakers can cause a whole lot of pain depending on their size and location. The small ones might just pass unnoticed, but the larger ones can get stuck in the urinary tract, leading to a serious amount of pain. When a kidney stone blocks the urinary tract, it can cause your urine to back up, limit your kidney function, and even cause some amount of bleeding in your urine. Now, how common are these kidney stones? Well, about 1 in 10 people will experience kidney stones in their lifetime. They are more common in men, especially in their 30s and 40s. Symptoms of kidney stones can include pain in your lower back side or the flank. It can be extreme. You can also have blood in your urine, nausea, vomiting, even in extreme cases, and difficulty urinating. What causes these stones to form in the first place? Well, it's mainly due to an imbalance of the minerals and salts that are usually filtered in your urine. When these minerals and salts are in high concentration in your urine, with not enough water, they can clump together and crystallize and form stones as a result. Other causes include some certain foods that are high in protein and salts. Lack of hydration is another one. And then some medical conditions as well as a family history. If you have family members that have had stones, you may be genetically predisposed to forming stones. There are different types of kidney stones made from minerals, amino acids, and salts. They include calcium oxalate, which is the most common. Then you have calcium phosphate, which is the second most common. Then you have uric acid, cystine, xanthine, struvite stones that are usually associated with infections. Each type has its own causes as well as associated risk factors. So what can happen if you have kidney stones? Well, they can lead to complications like kidney infections, blockage of your urinary tract, and even kidney failure if they are left untreated. Now, how do we diagnose kidney stones? Diagnosis involves urine tests to check for blood and crystals in your urine, imaging examinations like ultrasound, x-rays, and CT scans, as well as blood tests to check for your kidney function. Let's talk about treatment options for kidney stones. Small stones may pass on their own with plenty of fluids and pain management with medications, but larger stones may require medical intervention. Treatment options include medications to help make the stones smaller and potentially pass on their own, and then less invasive procedures like the shockwave lithotripsy, which is basically a fancy name for a procedure where high energy sound waves are used to break up big stones and make them smaller and potentially pass on their own. Nephrolithotomy is another fancy name for a procedure where a small scope is placed into the kidney to extract small stones. Then the more invasive surgery can be used to extract very big stones. Can kidney stones be prevented? Yes, prevention of kidney stones involves drinking a lot of water, limiting certain foods that are high in protein and salts, taking prescribed medications as needed. All these can help reduce your risk for kidney stone formation. Finally, what can you expect if you have kidney stones? Well, most small kidney stones will pass on their own, like we have discussed, but the larger ones may require intervention. And remember, kidney stones can be temporary. With proper treatment and lifestyle changes, you can manage them effectively. There you have it. If you suspect you have kidney stones, don't hesitate to seek medical help. If you have additional questions or would like to share your experience with these painful stones, please drop them in the comment section. Let's talk. I'll see you in the next video.